And you can all introduce yourselves. We're very honored to have people with us who really are addressing a very important issue and focus. This is really a Cobalt presentation in collaboration with Focus, and it's wonderful to have all these people trying to figure out how to get resources for our faculty and staff. Rachel?
Hi. Jeanette and I are so excited to be here today. We're going to talk about proactive care planning for older adults. I'll just introduce myself. I've been here at Penn about 16 years. I'm a professor of clinical medicine in the Division of Geriatrics, Vice Chief of Education. And I'm really passionate about thinking about how can we best care for our aging population. And I'll let you go, Jeanette.
Sure. Hi, I'm Jeanette Gallagher. I spend most of my time in geriatric medicine, an outpatient, and some of my time as a part-time lecturer in the School of Social Policy at Penn. I'm really happy to be here. I've known Rachel for a long time. I've been with Penn for 18 years, and this is kind of my passion.
Yeah, and our goal today is, first of all, we always say this, we cannot talk about everything for care planning for older adults. So we're really going to talk about what we consider the proactive aspect that you'll see today. And I think our hope is that you'll see that throughout this year and the coming years, we and other members, not just us, will be offering more and more resources for how we as a community can think about caring for older adults, because this is a reality for so many of us. And we want to be here to support you. Lucy mentioned Cobalt as well. I'll mention them and the new resources that we have been supporting for them with Bettini Bunya as well. I'll show a slide at the end for that. So we have a bunch of slides that we will talk about, but we really want this to be interactive. So if you have questions, please put them in the chat. Most likely we'll come to them at the end, but if it makes sense and we can manage, we'll answer it throughout. But we really do want to hear from you and be able to answer for you as well. We will definitely have time for discussion. All right. So like I said, our focus today is really this pre-planning. And as we know, as we're taking care of older adults or interacting with older adults, or some of you might be thinking about yourself, this is a process. And actually, one of the reasons that I use this picture in this slide is I think about this all the time. Like we do so much planning. I have kids and I think about like what do I need to do for school for my kids or activities for my kids, and then we go to college or we get a job and we think about that and then we work. And then we don't necessarily put the same time into thinking about what happens, after that work stage or after the kids leave the house, when we sort of get into, this retirement age or this aging phase of life. So our hope here is that today you'll start to think about that we can be deliberate in how we think about this process. Of course, there's going to be crisis, and of course, there's going to be unanticipated things. But our goal is that we start saying, okay, well, what can we do, ahead of time, or how can we help the older adults in our lives plan ahead of time? So again, we're going to talk about creating a person-centered care plan for an older adult, recognize that some changes in health and daily function, although that won't be the total focus today, identify some ways to promote healthy aging, and really talk about supporting networks and resources. Each of these bullets can be a talk itself. Some we'll talk more about, and some we'll talk less about. But if you find there's a particular topic that we touch on that you want to hear more about in the future, please also let us know, because that helps us know and the Cobalt team know, what information that everybody wants. So first, Jeanette and I wanted to start out with talking about the geriatrics framework. And so, as we said, I'm a geriatrician. Jeanette is a geriatric social worker. And we're really coming from taking care of older adults and thinking about this model. And comes from the age-friendly 4Ms. We've added a fifth M, but we're always thinking about what we call mind. So that's mentation, cognition, depression, delirium, mobility, that's function and falls, medications, and then most importantly, what matters most. And we'll talk about that more specifically. And then sort of the multi-complexity is sort of the rest of the biopsychosocial model and the medical issues of taking care of older adults. And I think it's really important, and you'll see this said again later, to think about aging in this manner. Because if we only think about it as the medical conditions, like, oh, my high blood pressure, oh, my stroke, then we are going to miss the big picture. And the big picture is that we really have to think about mind and mobility, and obviously what matters most to the person as well. So that's where we're coming from. And these are just a few scenarios I threw out there that people might be thinking about. You might have other ones. My parent's going to retire. What are they going to do? My older adult friend is retired. What can they do? My loved one's significant other recently died. What should I look out for? And my neighbor doesn't have any family nearby. Is there any family at all? Is there anything I should be thinking of? And I know that you guys all have a lot of other scenarios in your mind. They're just sort of in the background. I'm going to hand it off to Jeanette here. So this is kind of the start, right? This is what we think about. How do we start out?
Great. Yep. So really one of the key points that we want to bring up is like talking early about goals for aging. In fact, I don't think it can be said that it can be too early. I mean, I think even now in my 50s, I think about some of this stuff, moving ahead. But the main thing is to think about and ask, like, what is important to them in terms of quality of life? Like, how do they want to live and what do they want to prioritize? And what do they envision their future as they get older? Like, kind of what are they thinking of, how do they want to age? And like what kind of things do they want to achieve? I think that that's like a really important talking point to bring that up, and just to, break the ice and just to know what somebody's thinking about, because we can't always assume that. So the thing and we can't keep stressing this, we will keep stressing this, but what matters most to them, because it really differs. So we're just really wanting to find out, what matters most. Do you want to travel? Do you have money for traveling? Where do you want to live? How do you want to live? What do you want to be involved with? And also, how do they see themselves staying active mentally and physically in the next stage of life? Kind of what kind of things are they maybe involved with, and what kind of things do they want to continue with, or what do they want to get back involved with? Maybe they hit pause on something and want to get back into something. And where do they see themselves aging? So, we'll get more into this, but do they want to remain where they are? Is that sustainable? Looking at other options, and are they affordable? And then also, how are they taking care of their health right now? Are they doing preventative medicine? Are they keeping up with appointments? Like, what does that look like as we're getting into, some critical times with aging and health?
Thanks, Jeanette.
Mhm.
And I think, as Jeanette said, this is so important because we have our opinions, right? And other people have their opinions. And if we don't talk about it, then we're missing the boat, because we might be coming at it from a totally different way. And we don't know what our loved one or our friend, older adult, is thinking. And people have thought about this, or people need to be pressed to think about how they see this next stage of life. And most importantly, what is important to them, what gives them purpose, what they want to continue to do, what they may want to add. And we'll talk more about some evidence-based. So, health engagement is really important too. And we don't want to, we talked about, we're going to talk about mind and mobility, but, keeping them engaged in their healthcare is essential. And thinking about you getting involved at an appropriate level is also important, but know that it may not be the right time. It may not always be the right time, in the very beginning. So when you're having these early conversations with folks, people have autonomy, and so they want to be able to take care of their own healthcare. So you may be offering your support, and you may be saying, I'm willing to help, or do you need help? But understand that people might not need you, they may not need that then. But certainly, I think knowing that it is an open conversation and you are willing to help, I think can be really helpful. And help can come in different ways, right? Help can come in, going to appointments with folks. It can be just in keeping up to date with what's going on with their health. It can be in transportation to appointments. There's all different levels of help and support. And again, most older adults that you're having this, we hope you're having this conversation with, still have autonomy and agency to be able to be active and, starting this process and engagement in their healthcare, or continuing a process, hopefully. So the other big thing I want to think about and focus on right now is health is not just your medical issues. And I brought that up in the beginning. It is not just somebody's high blood pressure. It is not somebody's high cholesterol or even, their arthritis. It is much more than that. And so these are some key changes to watch for in aging and even things to talk about for people to start to think about. Number one is function. And so when I think about function, I think about that, back to mobility again, right? So how do you get around? How do you walk? Like, how do you stay active? Are you exercising? And also we think about function as what we call the activities of daily living and the instrumental activities of daily living. And so we always say the activities of daily living are those like basic things that you need to do to be able to, age in place or live safely, where you are. And so that could be, can someone get up out of bed? Can they go to the bathroom, brush their teeth, get showered, get dressed, and go to eat breakfast? And can they do that independently or do they need help? And sometimes help could just be a device. Somebody has a walker or a shower chair, or sometimes they need a person in order to help them. And then those instrumental activities of daily living, they're like the fine-tuned things that I say we try and get done when we have a day off, but it could be like going to the bank, taking care of your finances, cleaning your home. Taking your medications is actually an instrumental activity of daily living, which is really important. And grooming and grocery shopping there, and actually using the telephone. And I always say now another one that we should be thinking about in those instrumental activities of daily living is the use of technology, because I think that's so important. For all of us, any age can use technology. So these are things that we want to maintain, right? We want our older adults to be as functional as possible because we know that function actually is a tremendous predictor of life, of how long you live. And it's just as important, and it aligns with, taking care of your other health issues. And we'll talk about some ways to keep folks functional. And then we also want to think about, cognition, so their memory. Not everybody who gets older has memory issues, right? So we don't want to assume that somebody has memory issues, but also as you get older, especially in your 80s or 90s, you can have more memory issues. So we don't want to ignore if somebody has some memory issues as well. And actually the first signs of memory issues are issues with those IADLs, those instrumental activities of daily living. And that's why it's so important to know, what's going on and to be watching out, because one of the first things you see is someone not taking their medications correctly, or obviously financial issues, which can be, complicated. And then the other things to think about is socialization. And I think COVID showed us this, but we actually had really good data before, is that keeping social is really an important aspect to, whatever we define as aging well. And it's also a sign that if somebody has a change in their socialization patterns, that something may be going on. And that's something else really important to think about too. So here's what we know about older adults who age well. And I put that in quotes because defining aging well is a whole nother topic about how we define that. So we know that social isolation is not good for your health. And that social isolation and loneliness are medical issues. And it's actually really interesting if you see, this is like a side note, if you see some of these social determinant screeners now, some of them are actually adding in social isolation, which is super, super important. But this is a big risk factor for older adults, especially if they retire or family has left the home, where their support systems or their networks can have drastically changed. And people may not be ready or have anticipated how much socialization they may have had in work, or how much that was sustaining them, or what they were doing, or whatever change in their life has been. So, we like to think about, and getting back to when Jeanette was talking about in the beginning, is when you're having conversations of how can people stay social? And so there are a variety of ways. Obviously, there's volunteering, and, it gets back to sort of knowing, what someone's interest is, helping them sort of brainstorm and think about this. There's community involvement in local organizations, and we've seen a lot of support from faith communities, especially for older adults. Senior centers are very there's actually a ton of senior centers, like 30 senior centers in Philadelphia alone, and each has a different flavor of different activities that people like. Obviously, family and friends, intergenerational activities are great. And then the use of technology, again, FaceTime, gaming, and gaming can be solitaire, but gaming can also be, with other people. I just went into an older adult's home the other day, and he had a PlayStation, right? And he told me that he plays with his daughters, grandkids, that this technology has been around for a long time. So, somebody who was playing, before can continue to play and interact with other folks. So again, so important, and you do not want to overlook this. Look, some folks never really liked active socialization, and I do think you have to be mindful of who the individual is, but also helping people brainstorm and think about ways to interact is important. And this aligns with keeping mentally active. Some of these are the same activities, so I'm not going to mention them all. I will add lifelong learning. I mean, we know a lot of older adults who participate in going back to school, right? And it can be auditing classes, it can be online, it can be going to local colleges. There's many community programs that have learning classes as well. And these are very full and very robust. I actually just had an Uber driver recently when I was at a conference, and he told me that one, he started driving Uber because he was bored when he retired. So getting a job was another thing. And then two, he started taking classes at Arizona State, and now he's like doing well, and he's like he didn't realize like how much he loved to learn. And it was just like a really great conversation that obviously, he was sharing with me, but I enjoyed hearing. Um, and then physical activity we'll talk about as well. And so getting back to the function, keeping physically active, and there are so many different ways, is so important for health. Because we know that the more functional you are, and again, the better your health will be. And it doesn't have to be that you're running a marathon. I know there was an amazing woman, I think she was 108, who just died, but she like started running in her late 90s or hundreds. You don't have to do that. You can walk, you can do chair yoga, you can do Tai Chi. I don't know if any of you have been at the pickleball courts lately. A ton of older adults, all abilities, playing pickleball and tennis and yoga, but you definitely want to keep your body moving. And that's one of the big things that we all also always stress. And this can be challenging depending the neighborhood you live in and your access. And so, there's things that can be done in your home, and there's programs online or exercises that folks can learn even from, physical therapy or from a trainer. And then folks who have access to like a local YMCA or community center can obviously go there. One of the big pushes, especially in Philadelphia for the senior centers, is that they have transportation to them, and often many of them have like silver sneakers programs. So they have exercise programs a couple days a week, and they have a lot of interest from the older adults who attend there. So we definitely want to focus on physical activity. And then these are just some additional medical issues to monitor. First of all, if you want to know like what's going on, this is like, I don't get money from them, but if you want to know what's going on in geriatrics or older adults, the New York Times actually has a very good aging well, or aging section, and has some nice writers who are really doing some good research. So these are just some topics there, but these are some of the things that you also want to think about and have your older adults thinking about, like making sure their vision is good, making sure their hearing is good, advocating for hearing aids is really important, because we know that both vision changes and hearing changes are related to an increase in dementia risk. Obviously, we talked about cognition and mood and falls already. And, again, beyond just the, high blood pressure, which is obviously important too. And I'll leave it over to Jeanette now.
Great. So yeah, I'm going to talk a little bit about home, basically the home environment, wherever that can be. And also really, what does aging in place mean? So it can mean many different things. Home can be a multitude of different places, and I'm going to explain some of those too. So I think a big thing to talk about kind of early on too is, where do you want to live, basically, or where can you live? the first place I think people think of is to try to stay in their current home with modifications and support. And there's a lot of different ways to do that. And a big push on that too, I think, is comfort, knowing their environment, neighborhood, access, kind of like, staying in their comfort zone. And also sometimes that can be one of the more affordable ways to stay. Probably maybe their place is paid off or they have a system where they pay for it. Because some of the other ones you look to, like next steps would be like a 55 plus community. Usually in the suburbs, there's different levels, different costs for that. Senior apartments, which can be kind of informal senior apartments. We have a lot that we see in the city that have just kind of become senior apartments that are not formally them, but then we also have a ton of low income senior apartments that we see patients in. So it kind of is a huge range. But then getting into more probably more, supportive living, but also a little bit more costly would be assisted living, and community, continuing care retirement communities. And then ultimately nursing home, which is the most, probably restrictive and, the highest level of care. But also like as people are thinking about that, I think early on is kind of looking at finances. And we'll talk a little bit more about that, but a big part of that is what people can afford looking ahead, and what would be the best match, I think. I think, yeah, that's thanks.
Okay. And I think what Jeanette's saying, it's important to understand, which the cost, of each of these different ones. So like she said, a home is your home, right? So that many people do want to age in place, and there are modifications, and we'll show some of them that people can have. The 55 plus communities, they usually buy a home. It's like a one level home in a community. I go to a lot of them in the suburbs. I do home visits. What's nice about them also is that they usually have like a community center or,
Mhm.
room
And
with,
socialization.
yeah, there's that socialization
Mhm.
aspect. So that's something else to think about as well. Obviously, an apartment is apartment
Yeah.
versus the assisted living. But if anyone has more questions about these sites, we're happy to answer them as well.
Okay, and where should they leave? Kind of like Rachel was saying, what resources are available at each location? So at home, like, even though that might be the most comfortable, like that would probably sometimes be a little bit more isolating because you're not around other folks. So then you would have to kind of look at, where you could get your socialization from, bringing help into the home, bringing support and modifications into the home. And then, looking at things like senior apartments too, or 55 plus, like Rachel was saying, usually there is more social activities going on within these sites. There's usually, less formal, but, still stuff that goes on within them. You kind of have to seek it out, but there's other people, around your age, and there's also usually different events happening. And then, of course, like the assisted living and CCRC and the nursing home would be more formalized, interactions and resources. Advantages and disadvantages, just like we were talking about, obviously asking the person what that really matters most to them. If they really have a strong desire to stay at home, then I think that the focus would be, is that sustainable? And we'll talk a little bit more about that, but what would have to happen for somebody to stay at home? What kind of modifications, or is it even possible if the house has a lot of steps, multi-level, then that could be a barrier to aging in place, possibly. But also looking at the other advantages of some of the other places, just having that all the services be there, having other sets of eyes on people, having full coverage around the clock at several of the places. Those are definitely advantages too. And then also, like we were saying, it all comes down to kind of like what the cost is. So financial planning with the pre-planning is really important. Kind of really getting an idea of what these facilities cost and what really is realistic for each person is very individual, and kind of what their priority is too. I have a lot of families that usually, want to keep the house in the family. So that's what their desire is, to stay and age in place because they want to pass the home down to somebody. So it's different things that really people desire. And then some people like very strongly want to get out and, live somewhere that things are taken care of a little bit more. So maybe a CCRC or an assisted living, because they don't want to have to be in charge of the property or maintaining the home or anything like that. So, it comes down to desire, but also like what is kind of affordable and what they can sustain as they, live through, how long they're going to live. So kind of how far they can kind of, let their money go. So, okay, so making the home safe for aging in place. So there's different things that you can have in what we consider formal and informal supports. So formal supports are things that you'd think about. So it would be like visiting nurses, Meals on Wheels, home health aides, house calls visits from a physician, or NP, social work and case management. And then later on, chaplain, hospice, maybe a palliative care situation. Informal supports would be family, whether they live in or visit. We see a lot of that, like families that really have their act together and have a system of like bringing food or meals and care. We also have some really dedicated neighbor situation or friends that come in and provide care or just drop off different things that people need, whether it's medication or food. Then also informal is either like any kind of faith-based or spiritual kind of support. There's a lot of different churches and synagogues and whatnot that really do like friendly visits and or can do things online so that people can still feel plugged in with their kind of, spirituality, which becomes really important, I think, if it's not already important to people, to maintain that and to have that connection. And then volunteers. So I'll talk a little bit about the area Office on Aging, but friendly visits from different agencies, whether it's there's a couple of student programs that they come out and do visits, or programs that older adults actually volunteer at that come out and visit older adults who are homebound. So I think a lot of that is really important to kind of like look at what would the support system be if you do decide to maintain staying and aging in place. Like what can support you? What do you have in your circle right now? What would you maybe need to like connect with and get more familiarized with? And then home modifications, which is a whole separate thing, which I know we have a slide for, and I can go through some of that for sure. So home modifications, here's some snapshots of some of the things that we have. So whether you know it or not, the bathroom is probably the most unsafe place in the house. Most of the accidents and falls happen there. So I think that showing the two slides on that are really important. So, if somebody wants to stay at home, I know like grab bars, which is shown most in the bottom slide here, become really important to make sure for falls get, in the bathroom. And then there's things like a raised toilet seat, so you're not having to get down as far and don't fall off. Sometimes there's little, like if you are in a senior apartment, there's like a little like alert that you can pull, like an emergency alert. And there's also just some of the basic stuff that you would have, so non-slip type of rugs and things like that. But also like the middle slide shows ramps to get into the house. So that becomes a big deal if anyone has like a walker or wheelchair, just to avoid the step situation. Many of the houses that we visit in Philadelphia have a ramp because most of the row kind of houses that we see patients in have like 3 or 4 steps going in. So they'll have some type of ramp. And sometimes it doesn't have to be a super fancy ramp like this one. It could just be very like simple so that they can get in and out with a wheelchair or walker, so they don't have to do the steps. And then on the right side here, or my right, is the stair glide. So those are really great if you do have multi-floors and steps, so that it gets, so, people can still remain, going to their bedroom on the second floor, bathroom up there, have a little privacy, but then come downstairs and have like full range of their house when they come down. And then I think that the bottom one is just the commode too. So sometimes if they don't have a first floor bathroom, the commode can kind of help out with that. So there's a checklist here to fix hazards in your home. Just another plug too. And of course, I don't get money for that, but occupational therapists are excellent for this type of role. There's many that you can get through like a skilled benefit, but there's a load that you can have privately to just come in and give you the once over. This is what you need in this situation, and this could really help for aging in place. But as I mentioned, stairs and steps, indoors and outdoors, always looking at things like slipping rugs, they become a big problem. But like, loose carpet, handrails that might not be sturdy, but also making sure that handrails are there. Sometimes you need to put one in, so that becomes an issue. Floors, are they clear? Is there anything to trip on? Is there a little step or anything like that? Kitchen, things like high shelves, like moving things to lower shelves is really helpful, or making sure that you have a proper stool. I've seen that a lot of times where people do not have the right kind of equipment in order to just step up into something. But sometimes even in home modifications, people will move cabinets a little bit lower too in order to reach if they are wheelchair bound or anything like that. So they can still have, you know, access to the things they need to cook and prepare meals, and they're not like doing unsafe things by getting things. And then bedrooms, like, making sure that there's proper lighting. That's a big thing so that people can see, because, kind of having low vision naturally, Rachel talked about that. Changes in vision can be really unsafe sometimes as you get older. And then a bathroom too. We've talked about that, but that's like the number one I would put the supports in. And then we do talk about transportation a lot. When it is still safe for driving, there's a lot of different driving evaluation centers where folks can get an evaluation, even if there's even just a suspect that maybe you shouldn't be driving. That becomes really dangerous if that goes on too long. But if you can't drive anymore, which is a huge loss of independence, kind of, figuring that out, processing that, almost like grieving it, and then also at the same time looking at what other supports there are. So if you can't drive anymore, is it still sustainable to stay in your home if that's like the only way you got around was driving, or you live some distance to things? But if you live in a more urban area, getting more familiarized with like taking public transportation, how to use Uber and Lyft on your phone, which becomes another technology type of thing. And then also what's covered under medical transport, like how is that covered and what kind of options are there? But I think transportation becomes a big thing because it affects everything, like, getting to senior centers and getting to medical appointments, seeing friends, keeping up with your social activities. So we think about that a lot. So yes, getting to know supports in the community. It can never be too early for this, I'd say. Every county in the country has an area agency on aging. Some are big and some are small, depending. Ours in Philadelphia area is PCA, Philadelphia Corporation for Aging. So if you go to the PCA website, which is pcacares.org, they have a plethora of information, just like Rachel was saying. Starting there, even to get familiarized with the senior centers, they have a list of all the senior centers in Philadelphia, and usually you can click on that and get onto a website and see what that senior center offers as far as their calendar, what kind of activities, meals, anything like that, which I always think is really nice, a small step for people just to kind of get, familiarized with, in their area, what exists. Also spiritual, older adult groups, resources. As Rachel was saying, it's so important to find out what's around you. And this could be actually, either where you're living or where you're moving to, where somebody decides to, like, scoping out all of these things to make sure you're familiar with what's around and what you can plug into. Community centers, libraries, and gyms offer a lot of different things for older adults. We always mention the Y because they seem to be, and also in Philly, the Croc Center, there's like some major, like, social and physical activities for seniors to get plugged into. Meals on Wheels and Mom's Meals, like delivery programs, also through your area agency on aging, loads of information on that, and how to access that. And then also transportation, like I was just mentioning. In Philadelphia, there's a couple different options like CCT. People on Medicaid have different paid options for medical transport. And then under the Medicare benefit, it just depends on, if you're in an Advantage plan or which plan you're in, kind of what kind of medical transport there is. But I think the earlier you know, like what's happening and what's being offered in your community, the better off you're going to be, for yourself or for your family member, for your friend, just kind of knowing that stuff. Because that's kind of what, if someone's before anyone gets into a crisis situation or anything complicated, I'm like, really just get to know like what the system looks like and what's around you and what they might be interested in. So,
Yeah, if you have one takeaway from this talk, this is it, right?
mhm.
Understanding the community. And sometimes you're understanding a community that you don't live in, right? It's that your older person lives in. And so, the area agency of aging, which we have slide about how to look for that, looking online, driving around even sometimes and seeing what's around there. And I think another actually place where people find out a lot of things is like Facebook. I see so many people
Yeah.
post in our community Facebook. I mean, sometimes they post nonsense, but they'll often post about resources or asking for resources, and then people will give, you know, good information. And I think that's another way, to think about that in an informal way.
Mhm.
You do want to vet anything, obviously, you see on social media, but can be helpful.
Great. Yep, and this is a little slide about PCA. They have a helpline, as you can see at the top, which I think is just great. Sometimes a little difficult to get through, but their website is really excellent. So I would definitely, go to that. But any area that you're in, just even if you like Google it, Office on Aging, whatever like area you're in, it should pop up and populate. So in that way you can find where these area and agencies on aging are. But everything that's listed here is kind of what they have. From senior centers, transportation, health and wellness. And then when I talked about the senior companion program, which I think is really cool, where older adults come and do visits to other older adults that are homebound. Even employment and job training, like Rachel mentioned, some folks want to remain working, as much as they can, even just on a part-time level to remain engaged. And then, connections in the community, all the help at home. That's a huge PCA or the Office on Aging is the biggest supplier of help at home. So programs such as waiver and options, which are paid for home health aid support at home. It's a great place to start as far as even just getting an assessment. All you would have to do is call and say, I want somebody to be assessed for services. They make a plan to come out to the home. They'll assess the person based on, both function and finances, and then you can go from there to see what somebody is eligible for. They also have an arm on protection and advocacy. So that's, around like if there's any kind of abusive situation or legal guardianship, and then caregiver support, which just becomes a big part of, probably any, taking care of a parent, taking care of a spouse, as you go into the later stages on aging sometimes. Okay. Yes, so starting a conversation about finances. So I know it's sometimes if it can be a touchy subject depending on who you're talking to, but I think it's really important to kind of crunch numbers early. Like what is somebody's income? Like how do they get money? Is it through just Social Security? Is it Social Security and a pension, some savings? Kind of what would happen if a partner died? Would they be able to, live on their own, and what kind of finances are they still eligible for? And looking at things such as, if there's still a mortgage, what kind of debts, as I mentioned, savings and Social Security, updating a will, I think ahead of time is really important too. Keeping that updated so that, they know where everything is going to be going. Avoiding scams, I'm glad this is on here because we have a lot of issues with that. With our older adults, it gets really confusing, even for us, with things that come through sometimes on the internet or calls, like getting into things. I know a lot of our patients got involved in like reverse mortgages when that was really a hot thing, and that's really, difficult to get turned around. Also simplifying financial processes. I think that that's a good thing to start early, kind of like setting up online payments and automatic bill pay when people start to slow down or you see there's maybe a few red flags about finances, where money is going. It doesn't mean they have to lose independence entirely. I think becoming, a joint person on an account is really helpful, or having access to what the online accounts are so that you can step in and say if somebody had a health crisis, you'd be able to pay their bills, things like that I think are really important. It says that in the last part is like, yeah, joint accounts and power of attorney. This may come later, but it's worth a discussion. Like I think it's very hard to bring this up sometimes, but I think that starting earlier, like saying, I know you have total independence, but if something happened to you, if something happened to me, who do you want to make the decision, and kind of like, and put that into writing. I mean, Pennsylvania is kind of an informal state. So we're not but I do think if anyone would contest it, that legal is really important to get involved, which leads me right into the legal part. I think elder care attorneys are great. In Philadelphia, there's two that I really like to refer to, which is one is the Senior Law Center, which they have intake hours and also a really good website. That is representing the seniors themselves, not the family members, unless they're a senior as well. And then Community Legal Services in Philadelphia has a senior arm to it, which is really excellent. And that's definitely, looking at things such as like power of attorney and wills and things that you would expect. Maybe looking at finances too, like how to like kind of shelter money and like set up different trusts so that not everything shows up in your accounts. So some of them are private pay, absolutely, but senior law and community legal usually do it either for sliding scale, or they definitely can be very helpful for cost. And the things they're looking to do are like two different power of attorney. So there's a durable power of attorney, which I know Rachel says that this gets tripped up a bit, but there's a durable power of attorney for property and finances. So that's what you would think. So if someone, sets this up, this is somebody that was going to carry out things like maybe a house or property or, personal investments and stuff like that. And then there's also a durable power of attorney for healthcare decisions. Sometimes they can be the same person. Oftentimes they're different. And we see a lot, like maybe if there's multiple children, one gets one job and one gets the other. But the healthcare decision maker would be the person that would make decisions if the person is unable to make decisions themselves. That's what I always want to like kind of prioritize, is that we're not looking to make decisions for anyone. We really want to set something up. So if someone becomes unable to say what they want, what their needs are, and I'll get to that too with the advanced care plan, you want somebody that you would trust to make those decisions and carry that out and put that in writing so that you have that. Because that avoids a lot of ambiguity and also, infighting sometimes with family who want to guess what a patient wanted, or a loved one. Also a financial will, obviously that would be the finances, but we do always really push, and I know I get asked that at my doctor's visits, do you have an advanced care plan? And I think that that's really important, especially going into any kind of aging. I think that you really have to have that. And that's really like, what you would want and not want, one for medical, basically. If you were to become hospitalized or, need any kind of resuscitation, like anything like that. So just in advance, you're basically stating what you would like done and what you wouldn't like done. And then the power of attorney would be the person that would kind of roll that out.
Thank you, Jeanette. And I think it's
Yeah.
always I have here, make sure someone knows where to find these documents when they're
Oh,
hidden.
yes.
That's always not good. So we always tell people like, do you know where they are? And does like one other person at least know where they are?
Mhm.
Um, we have a lot of takeaways today. I'm not going to go through these, but I mean, our main point here is let's start the conversation as early as you can and think about this is just like we would plan these other stage of life. We want to start to plan, the end, which the last stage, which we hope is many, many, many years, right? And if we start to think about these aspects of health and the bigger picture of health that we talked about, and then sort of the nitty gritty of aging in place and where people want to live and the finances, that can really help people prepare and take away a lot of the stress. There's always going to be stress. There's going to be crises, but the more we are deliberate about this and think about this, the better prepared we are for those crises. And so I just want to also show here, because there's a new Cobalt page. I don't know how many of you are familiar with Cobalt. I did put the QR code here, and Cobalt is co-sponsoring this talk today. So we're super excited about that. Vatini Bunya and I helped to support this with them, and the Cobalt team is amazing. And it's a Caring for Aging Adults resource page now. I just put up a couple screenshots here. You can see they plug this group session. There's another one actually later in the month. I couldn't put them all here on the Wealthy program. I definitely encourage you guys to see what sessions are available, and they're all recorded as well. There's a resource library with some great resources. And then this talks about different employee benefits that are available. And again, all of these could be more talks and more things that we'll be focused on. But, look at this page, check out this QR code. I think it's going to be we hope it's going to be a really helpful resource. And we also want for it to be useful. So if you have thoughts and stuff that you want, then, comment and let the team know. And I'll just thank you. We're definitely here for a few more minutes for any questions. I know we ended up talking probably longer than we want because we always have a lot to say. If anyone has any questions, please speak up. You don't have to put it in the chat. You can just speak, or you can put it in the chat. And we're here.
Bunya